Thank you very much, Andrew, for that clear and concise presentation. We're now going to move on, and I welcome to the stand Dr. Heather Grimbaldeston, Joint Director of Public Health for Central and Eastern Cheshire Primary Care Trust. And on with the show, Heather.
Thank you. I will get this microphone wrong, so wave at me if you can't hear me, all right? From the back, okay? I'm Heather Grimbaldeston. I'm your Director of Public Health, and just following on from what Andrew said, I think we're here to discuss changes today, changes that aim to continue the job of improving the health of people in South Cheshire. And that is quite a job, because we've got a lot of changes going on, but I think they're going to be changes for the positive. Next slide, please, thanks. So what is the public health, and what is public health? Let me just explain for 1 minute what public health is and what it's made up of, and then I'll get on to the detail of what South Cheshire looks like. Okay, public health is generally said to be made up of 3 bits. The bit that started in the 19th century is the middle red column. That's about health protection. That's about, in general terms, making sure we don't suffer disease as a result from things that are out to get us, like the bugs in general. Okay. The first example was John Snow taking the handle off the water pump in London when he realised that it was important that it was spreading the water pump was the cause of disease. Okay. We've moved on a bit since then. We now stop those bugs attacking us, not by removing water handles, but by vaccinating. And many of you will either have children or grandchildren that have had immunisations, yeah? To stop them getting those diseases and illnesses. And actually in this part of the world, you actually do take your children in huge numbers to get those immunisations. We also operate screening programmes. They aim to detect diseases very early or before they're even a disease. People had screening, breast screening, bowel screening. Yeah? Had your screening program. It's another big set of public health programmes that aim to stop people going on and getting sick and ill. And probably most recently is we've now got a vaccine that aims to stop girls in later life getting cervical cancer, and that's the HPV vaccine. And again, we've had some huge successes working with the council where Vale and getting young girls to have that vaccination. So it's a really important part of public health. The other 2 bits of public health I'll describe a little more quickly. One around making sure the right services are in the right place at the right time and doing the right things, and we work very closely with actual services to make sure that that happens. That's the more purpley coloured there. And then what's called health improvement, which is those things that we do to either help people not take up damaging or adverse lifestyles like smoking and drinking and becoming obese, and also working with the local authority on what we call the wider determinants of health, so that making sure people have a good baseline, have good housing, good transport, good economy, jobs, so that they can start to improve health from a really robust baseline. That's what public health does. That's your health and how we describe your health. I'm sure you describe it in lots of different ways. It's underpinned by really, really robust and good data and intelligence and really, really good partnership working, which Andrew's described. Next slide. Let me just take you through not what the GPs have told us, but what the data and intelligence tells us about the health of residents in South Cheshire. I'll do it in 2 ways. This slide's taken from my annual report in 2009, which looked at the health of every single practice across the PCT, which runs from Poynton down to south of Crewe. And we described and we presented this data to a lot of the practices, and we presented it actually here to the Crewe, Nantwich and Sandbach and Congleton practices about a year and a half ago. And we found that actually this is quite a diverse patch, quite a broad life expectancy difference across that patch. But in general, people are more likely to say that they're not sure that the health is terribly good. That's a 2001 statistic from the census statistics from the 2001 census. So I'm waiting to see if that's improved. We're not actually sure it has based on our own local data. lots of people suffering from breathing problems, but probably that follows on from a lot of people who have, and it's said here, unhealthy lifestyles, but a lot of obesity, not many people taking exercise, smoking, harmful drinking. We'll come back to that in a minute. And in this part of the PCT area, that poor health tended to be worse in deprived areas. That isn't the case in the east of the patch, around Macclesfield. But there is a very clear link, like there is in much of the northwest with deprived areas. We would expect more people to go to their GP with breathing problems. We did an analysis of how many people went to their GP with various things, and we'd expect more, and that's probably because people tend to put up with illness quite a bit. And we were going to see quite an increase, more than in other places across the patch, of people aged 65 and over. So, good story. But actually, people were living longer, but actually that will bring with it some of the burdens on the health service. Next slide, please. We then did, the following year, did another annual report that looked in more detail at the lap areas. Looked at Crewe, looked at Nantwich, and looked at Congleton. Anybody here from Congleton? Excellent, excellent. Okay. So we've got a little purple square talking about Congleton, and I can. There are some handouts that are at the back that actually describe the health of Congleton in a lot more detail, and I know the Congleton Labs had a detailed presentation about their health. Anybody here from Nantwich? Two. Okay. Great. Little box there for Nantwich. Are the rest of the people from Crewe? Everybody else is from Crewe? Yeah? Okay. No? I can't leave that undone now. Ordlam. Excellent. I haven't got a box for all of them. I'm very sorry, but I don't have a box. But got a box for Crewe, and we'll start with Crewe. But actually, Crewe has very, very significant health differences across the town. I've got a much better diagram that shows those differences, and they are stark. And there's a difference in life expectancy across the town of Crewe of 9.3 years for men and 10.9 years for women, which means that in some places men will be dying soon, 9.3 years sooner than somebody in the next area. Okay, that's quite significant, quite significant. Across the PCT area, Crewe has really the most problems with lifestyles in terms of unhealthy lifestyles, and that the one that's not on there is alcohol, but actually alcohol as well. More people smoke, more people are obese, more people don't take enough exercise, more people drink heavily in Crewe. Which then, unsurprisingly, leads to more emergency admissions, more early deaths from heart disease and stroke, particularly for men. More problems with breathing, we said before. And we also we'd expect more people to go to see the GP with asthma. We addressed that in the previous slide. Significantly, linking to the deprivation, spoke to before, more people in Crewe claim job seekers are than anywhere else in the PCT, and more people have no qualifications between the ages of 25 and 65. That's nearly 30% actually. That's a huge figure. Okay. Nantwich, a much less difference in life expectancy, a much more uniform picture in Nantwich, but still some unhealthy lifestyles, particularly this was ascertained from the GP records, quite a lot of people smoking, quite a lot of people with high blood pressure, and we'd expect again more people to go to see the GP when they have breathing problems. And Congleton, not to forget Congleton, differences in life expectancy quite large there, so quite a lot of difference across the patch in Congleton, and high levels of heart disease and asthma, and certainly quite high deaths from cancer in females in Congleton. Next slide, please. So, what have we done to date? Well, that just says we've been able to target some of our activity around those issues. Specifically in Congleton, we've targeted some areas for stop smoking service. In Crewe, particularly linked to those cancer deaths, we've tried to work with both the North West region and the local area and the GPs to put in place a number of programmes to alert people to go to their doctor early if they have symptoms. It's a very tricky issue. Put in place stop smoking services and support for the Polish groups. However, I think there is more to be done, and I'm certainly looking forward to working with the new GP commissioning group and the local authority, next slide please, to make sure that we continue to improve services and improve health and improve those statistics in South Cheshire. Andrew spoke a little bit about the changes that are going to happen in the NHS. These are the changes that are happening to public health, probably less well publicised. But the majority of those functions that I talked about in the first slide, that were in the green column, which are around lifestyle changes, which are around making sure and ensuring the good work's already done, around housing and transport we contribute to, will be moving to the local authority. That will happen in 2 years' time. There will still be a local director of public health, but they'll be employed by the local authority. There'll be a new organisation, a national organisation, that will look after some of the bugs and the health protection issues. There will be a ring-fenced budget for which we'll be accountable for spending to ensure that the public's health is improved in those 3 areas that we'll have to account to you for. And we're going to be, the Director of Public Health will be a member of the new Health and Wellbeing Board, which is a new organisation which is being set up under the auspices of the local authority to join up and coordinate services. So some of the examples that Andrew talked about will, at quite a strategic level, be looked at and hopefully try to iron out some of the hiccups that happen when people move between services. Okay. I'm going to hand over to Mark Pyrah, Chief Executive, to talk about the last slide, which just gives us an indication as to how difficult the environment is that we're working to make some of those changes happen. Thank you.
Thank you. We did one of these sessions in Nantwich recently, and I thought it was really important that we put into context before we give you an opportunity to ask us questions where we are financially and the impact of the recession on healthcare. I start that by saying that actually health has done remarkably well in comparison to our local authority colleagues and other public sector organisations when it comes to funding. But actually, I'll talk through this slide in case you can't see it, but it is important that as we talk about the future, we put this into context. These bars represent funding at different points in the NHS, and they are averages. If I can look here, that's there is somewhere an average since the NHS was created. The bottom line is the annual increase in funding since the NHS was created in 1948. So on average every year we've got 4%. That's a 20th century average. That's what was spent on average every year in the 20th century. That's the 21st century average, way down here. Here is the highest average, that's the Blair government there, over there, and there's the lowest by any government administration, which is 1951 to 1963, and nobody in this room will remember that, of course, but that's the lowest level of funding by any government since the NHS was created. And these are average annual increases in funding, and that's the next 4 years. So the green at the top is what's proposed that we have as an increase in funding over the next 4 years. So when we are answering questions and when we're talking about the future, I just think it's worth having this kind of financial pressure in context, so that actually we're not trying to come up with excuses about why life is very difficult and why we need to think about the money as well as everything else we've got to think about, but we are working on this context at the back of everything we talk about.
I think we'll have a round of applause for Heather and Mike. Thank you very much for that.